Okay, hi guys. Welcome to the first class of Anatomy and Physiology. In the medical field, there are terms that are pretty hard to understand and pronounce. And the ironic thing is that these terms are supposed to help the medical practitioners and scientists to improve communication about the bodies of the injured or the examined. So, first, important terms you should understand are the terms anatomy and physiology, which is the title of this class. Anatomy is defined as the structural makeup of an organism, such as a human. For example, the study of the human leg is an example of a study in the field of anatomy. The term anatomy comes from the Greek word anatome, meaning to cut apart. Physiology, on the other hand, are the functions of an organism. For example, maintaining homeostasis or how muscles contract. So, many medical practitioners and scientists divide the study of anatomy into fine anatomy and gross anatomy. The fine anatomy examines the microscopic features of the body like cells and tissues. Gross anatomy looks at a larger anatomical structures such as the body's systems and organs. So, a related term, pathology, is used to describe anatomical and physiological studies of human disease. And pathology comes from the Greek term pathos, which means pain or suffering. Now we got ourselves familiarized with some of the terms in the anatomy and physiology field. Let's move on to the human body orientation. So if a doctor asked you, please lie down facing up, you understand them and lie down with your stomach facing up. However, if a doctor says, please get in a supine position, you might be kind of confused, because since supine is a medical term, not a normalized term. So, body orientation and positioning have developed terminology that communicates precise information in the medical fields. The terms we are about to see are the common reports describing the medical conditions and orientations. So, the body direction is divided into two sets of terms referring to directional orientation and directional planes. Directional orientation refers to the particular view you see of a person. For example, the face or like the back of the head. Directional planes include a series of terms that describe the way a body can be divided into parts for viewing surface features or internal structures. So this figure shows a front view of a person standing in an anatomical position. Anatomical position is when the patient's arms are placed with the palm forward. From this position, we can see the midline of the body. So this is the midline, the red line. The midline is the imaginary line that runs up and down through the center of the body. Body parts closest to the body's midline are called medial orientation. We can say that we could say that the nose is medial in the location to the ears, and thus, or in contrast, lateral refers to the structures away from the midline. So ears are lateral to the nose. Superior is a term referring to any structure that is located above or closer to the head. For example, eyes are superior to the nose. In contrast, inferior refers to a body part that is below another. So the nose is inferior to the eyes. Next we have the terms distal and proximal. Distal specifically means any part located far from an attachment point. Attachment point meaning joints and such. So for example, hand is distal to the shoulder. If you could see in the figure, that you could see that the hand is farther away and this attachment point of the shoulder. Next, in contrast, proximal has the opposite meaning of distal. Body parts closest to the attachment point are considered proximal. The shoulder is proximal to the hand. See that the shoulder is closer to the attachment point than the hand is. When looking directly at a person's face, you're viewing his or her anterior. Anterior comes from the root word ante, meaning up front. For example, the nose is anterior to the ears because it is closer to the front of the body. The term ventral can be used in place of anterior as well. They are interchangeable. And posterior refers to structures closer to the back side of the body. And dorsal is commonly used in place of posterior. The ear is posterior to the nose. So anterior and ventral is interchangeable, and dorsal and posterior is interchangeable words. They mean the same thing. Now, let's move on to directional planes. Human figures can be sliced into 3 ways in order for viewing of the human body. Directional planes are used to describe the location of parts when imaginary or real cuts are sliced through the body. So a sagittal plane cuts the body lengthwise into left and right sections. Sagittal sections can be cut into any body part, but it's only the mid-sagittal plane that cuts the body into equal halves. So if you see, this is the sagittal plane right here. In this figure, you can see that it is cut down straight in the middle, and that's called mid-sagittal. Not all sagittal planes are cut down right in the middle. They just cut into any body part, but mid-sagittal, they cut straight down the middle, cutting the body into equal halves. So next we have perpendicular to the sagittal line is the frontal plane. It's in the middle figure right here. The frontal plane slices the body vertically into anterior and posterior sections, or ventral and dorsal sections. And transverse plane cuts the body along the horizontal plane and divides the body into lower and upper sections, or as we learned before, superior and inferior sections. So many medical procedures and therapists require that a patient be placed into a certain position on a chair or a special table. And there are special terms that are used to describe the specific ways a patient can be situated. The most common is the sitting position. As you can see, this is the standard way people would sit in a chair or at the edge of the table. This is also a very common situated position when you're getting your medical exams and they're just asking you questions. And next, another common sitting position is the Fowler's position. This is when the legs are held straight out and the back is supported by the back of the chair or a wall. There are situations where doctors require clients to lie down on a table, and it's actually really common. And there are many ways to lie a patient on the table, starting with the supine position. The supine position places a person flat on his or her back, facing up. The opposite of supine position is the prone position, in which the person is lying face down on the table. And this is also a very common position called the Trendelenburg's position. In this position, the patient is supine with body tilted so that the head is lower than the legs. And there are also the modified Trendelenburg's position where the legs, if you see in this picture over here, the legs are kind of face down. There are also modified Trendelenburg's position where the legs are just straight up. And There's also dorsal recumbent position that places the patient supine with his or her knees bent up. A similar position is the lithotomy position, in which the person's legs are placed on supports that hold the ankles and spread out the legs. There are also two commonly modified prone positions. In the knee chest position, the patient is facing down and his or her legs bent and the buttocks pushed up. And this is the Sims position, where the person lies face down or on his or her left side with the arm behind the back and the left knee bent. So next we're going to go on to the movement terms. Movement terms, or suppose I say, are important since they describe the ways arms and legs are moved in relation to the body. So before we move on to the terms and movement, it is important to note that each movement has an opposite movement. This is called antagonistic. The term flexion means to bend a joint, and this brings the distal end of an arm or leg close to the body. Bending the elbow or knee are the two common flexion movements. Extension is the opposite of flexion, and it is the movement that straightens out the joint. And straightening the elbow or the knee are the two common extension movements. Next, we have abduction. Abduction here. Abduction means to move the whole arm or leg away from the midline of the body. The antagonistic movement is adduction, which means that the whole arm or leg is placed flat against the body. Eversion is the movement that rotates the hand or foot so that the thumb or great toe moves away from the body's midline. So right here. And the antagonistic movement is inversion, which turns the hand or the foot inwards towards the body and towards the midline. Next, we have the body region terms to describe the body as if viewing a map. And they describe the specific locations of body parts or regions on the surface or inside the body. Anatomical terminology pinpoints particular regions of the body that may need attention or injury. The term superficial describes any part or region close to the skin or outer surface of the body. The muscles would be superficial because they're found right beneath the skin. A deep structure, in contrast, is one that is found away from the body surface and more towards the inside of the body. For example, the heart is an example of a deep structure. Next, we have bilateral. Bilateral describes body structures that are located laterally on both sides of the body. So, for example, the eyes and the ears are bilateral structures. They are both present on both sides of the body. The opposite term of bilateral is unilateral, and it is used for a single body part found in a lateral location. For example, the heart's location is unilateral because it lies slightly to the left of the body's midline. Now let's talk about the abdominopelvic region. The abdominopelvic region describes the part of the body lying just below the breasts and just above the groin, and it is very important. It is a very important region of the body because it contains almost all of the major body organs. The abdominopelvic region is divided into sections using terms that describe a particular location. So in the upper right corner of the abdominopelvic region lies the right hypochondriac. Its name comes from the fact that it sits below the the ribs. The left hypochondriac is the opposite position in the body, and between these two regions is the epigastric region right here. And it has this name because it sits above the stomach. And below the hypochondriac is the right lumbar region. And on the other side of the body is the left lumbar region. And the term lumbar means at the waist level. And medial to these two regions is the umbilical region. And the right inguinal region makes up the area of the right lower lateral part of the abdominopelvic region, while the left inguinal region is on the other side, and they lie directly upon the pelvis. And medial to the left and the right lumbar regions is the hypogastric region. And sometimes doctors use the quadrant naming system, which divides the region into 4 parts. The right upper quadrant overlaps the right hypochondriac, epigastric, right lumbar, and umbilical regions. The left upper quadrant overlies the left hypochondriac, epigastric, left lumbar, and umbilical regions. The right lower quadrant overlaps the right lumbar, umbilical, right inguinal, and hypogastric regions. And lastly, in the left lower quadrant, it has the left lumbar, umbilical, right inguinal, and hypogastric regions in there. And the last thing we're going to discuss today are the body cavities. So human body is divided into distinct body cavities that contain particular body organs. The large cavity called abdominopelvic cavity forms a hollow space within the abdominopelvic region. So the abdominopelvic cavity is actually composed of 2 cavities, the abdominal cavity and the pelvic cavity. Here, pelvic cavity and abdominal cavity. And the abdominal cavity contains the liver, gallbladder, intestines, kidneys, spleen, and stomach. And inferior to the abdominal cavity is the pelvic cavity, in which it includes the rectum, the reproductive system, and the urinary bladder. And superior to the lumbar region is the thoracic cavity, right here in the chest area. And it provides a covering that encases the esophagus, heart, lungs, and respiratory trees. Within the skull is the cranial cavity, which surrounds the brain. And lastly, we have the spinal cavity, which covers the spinal cord. So this is the overview of the first lesson of anatomy and physiology. So let's go over what we have learned today. First, we talked about the difference between anatomy and physiology. We said that the anatomy is the structural makeup of an organism, and physiology is the study of how the body works. And then we talked about the difference between fine anatomy and gross anatomy, where fine anatomy is features that you can only see from a microscopic view, while gross anatomy is a larger anatomical structures. Next, we learned about pathology, which is the study of human diseases. And then the directional orientation versus the directional planes, where directional orientation refers to a particular view you see of a person, and directional planes, which is terms that describe the way a body can be divided into parts for viewing surface features or internal structures. Next, we talked about the midline of the body, where you can see the red line here. And then the medial is the body part closest to the middle of the body, or let's say the midline. And lateral is the body part further away from the midline of the body. Next, we learn tons of terms that medical uses, and those are superior and inferior, where superior is a structure that is located closer to the head, and inferior is a structure that is closer to the bottom of the feet. And then we learned about distal and proximal, where distal body part is located far from an attachment point, and proximal is located closest to the attachment point. Then anterior and posterior, where anterior means the front and posterior means the back. We learned about directional planes, sagittal, frontal, and transverse. We also learned different positions where doctors put their patients or clients in. So the sitting position, Fowler's position, supine, prone, Trendelenburg's position, dorsal recumbent, lithotomy position, knee-chest position, Sims position. And then we moved on to movement, where antagonistic is an opposing movement, and flexion is bend of the joint. I forgot, abduction is not straightening out a joint, it is extension. That's a typo. And then we continued abduction, moving away from the midline of the body, and adduction, placing flat against the body, and eversion, rotating to move away from the body's midline, while the antagonistic movement is inversion, where the body moves inward towards the midline of the body. Then we learned how the superficial term means body part closest to the skin, and deep structures means closer to, further away from the superficial. Unilateral just means a single body part in a lateral location. Bilateral means structures are present on both sides. Then we moved on to Abdominopelvic region and described the 9 parts of body line just below the breasts and just above the groin. Then lastly, we talked about the the 4 quadrants, and the right upper quadrant, the left upper quadrant, and the right lower quadrant, and the left lower quadrant. So that is it for today's first lesson. I hope you guys enjoyed anatomy and physiology, and if you guys have any questions, please leave a comment below, and yeah, thank you.